Uh, Good evening, doctor. Uh, Doctor, a very good evening to all the element doctor. Thank you so much for joining us for today webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once a prostate vaccinated. This is through its innovation so serve to the society and humankind. The topic of the webinar is those introduce a strategy in rabies management, the role of novel vaccine. Dear doctor, rabies is the world's first novel three-dose anti-rabies vaccine, and with great pride, we would like to inform you that rabies has successfully completed 1 year of launch with more with this, my honor to introduce you to a speaker of today webinar, Dr. Pradeep Kumar, a specialty MS laparoscopy surgeon and general surgeon. Dr. Kumar associated with Dr. Nursing Home and also lifetime member of Indian Association of GI Endosurgeons, Indian Hernia Society Association of Surgeon of India, and Dr. P. Kumar also awarded by Rashtriya Ratan 2005, Best Society Care Hospital of UP 2016 by Dr. Harshvardhan. Dr. Pradeep Kumar also awarded by Global Excellent Award 2018. Presently, Dr. P. Kumar is Vice President of Sri Varshney Degree College, Aligarh. Now, I'd like to request Dr. P. Kumar to initiate the talk. Participants can drop their question in Dropbox, and we will read out all the questions after the presentation. Now, I hand over.
फोटो आता रहेगा हेलो मेरी आवाज पहुंच रही जी हेलो गुड इवनिंग myself Dr. P. Kumar from Kumar Nursing Home, Aligarh, and today we are going to discuss dose reduction strategy in the rabies management role of novel vaccine Tharabis. As you see in this picture, that the Tharabis is new development for the patients who are suffering. स्लाइड करके बोलते जाइएगा मैं स्लाइड कर रहा हूँ स्लाइड प्रिंट करके बोलते जाऊंगा जी आवाज पहुंच रही है हाँ आ रही है देख लीजिएगा नहीं आ रही बोल आ रही है आवाज मैं इको करके बाहर साइड मैं यहाँ बैठ जाऊँ कोई दिक्कत नहीं है वो स्लाइड लैपटॉप के पास अच्छा आप स्लाइड पे ना हाँ स्लाइड आपको यहाँ पे चेंज नहीं करो यहाँ पे भी चेंज हो रहा है अदर जो डॉक्टर देखने की वजह है वो आपका स्लाइड तो यहाँ पे कर दूंगा जी स्लाइड ठीक So, the dear friends, now we are going to start the today's topic, the dosage reduction strategy, the rabies and management role of the novel vaccine. You see, this vaccine is a new development, especially between the rabies dog and the human beings, to bridge the gap for immunization of these patients. As you see about the contents, the rabies disease, the animal bite incidence we will discuss, epidemiology, evolution of the rabies vaccine, challenges, the unmet need, and introducing the TH rabies, novel technology, clinical study phase 2 and phase 3, and take away message. So, first of all, we see the structure of the rabies virus. You see, this is the structure of the rabies virus, where we find the detailed structure, out of which it is covered with the various proteins, G protein, N protein, and we know that rabies is a zoonotic disease that is caused by the biting of the dog, caused by the rabies virus. Virus is encoded with the 5 structural proteins, and the name of these proteins are G protein, N protein, T protein, M protein, and L protein. Protein is the major antigen in the formation of neutralizing antibodies against against the rabies virus. So we will highlight this thing that the G protein. Globally, as per the epidemiology, 59,000 of the deaths occur due to the rabies every year. And the India contributes about 20,000 deaths per year, out of which 90%, 1% death occurs from the rural area of the India. Rabies is, as we know, 100% fatal, but 100% vaccine preventable disease. I mean to say that if we don't get the vaccination, death is inevitable. And if we go for the vaccination, we can prevent the disease almost 100% by this vaccine. In the same way, now we discuss the evolution of the rabies vaccine. You see, in 1885, you see, at the start of the vaccination program for the rabies in 1885, we started with live attenuated vaccine through the spinal cord and the non-standardized drive preparation. And the most important part was 31 injections has to be given at that time. But as the advances took place in 1911, inactivated vaccine was used and the 14 injections of 0.5 ml daily were required. As the advancement go ahead, in 1976, this cell culture inactivated vaccine was started and the 5 injections were the regime to start with this injection. The current challenges are 3 in this. The challenge number 1 is the current rabies vaccine are cell culture vaccines. Second challenge is inactivated vaccines are more than 50 years old technology and the decreased compliance beyond 3 injections. You see 4 injections and 5 injections regime. In the 4 injections, the non-compliance is a major issue. And in the 5 injections, also the same problem of the non-compliance. Now, meeting the unmet medical need, introducing a novel vaccine with simple and shorter regime. Introducing the TH rabies, Tharabies. This Tharabies is manufactured by the Cadila, is the upcoming 0.5 ml vaccine derived from the recombinant rabies G protein vaccine. First protein subunit of the vaccine, then prepared by the VLP platform technology, and the first vaccine with 3 doses, intramuscular regime 037, and better compliance due to the AG to follow the regime and less visits, convenience, ready to use, no constitution is needed. Now the VLP technology, what is this VLP technology which is derived producing this vaccine? native virus, as we see in the picture, the G protein is difficult to stabilize. And the G protein isolation using the VLP technology purified and stabilized by the Kedla Pharmaceuticals Private Limited. The VLP means virus-like particles. These are the proteins complexes exist as nanoparticle, virus-like particles, VLP. VLP are similar to the native virus particles, but that do not contain the viral genome. So they cannot replicate, but can mimic the viral antigenicity without being pathogenic. They are capable of inducing a strong humoral and cellular immune response. VLP as the vaccines. So VLP means the viral-like particles, virus-like particles, which help in the vaccination, in the production of this vaccine. Now, the original research articles, a novel recombinant rabies G protein vaccine, TS-Tha-Rabies, a VLP-based rabies vaccine, which see in the journal it has come. Next, when we clinical phase 2, the study the design with 2 doses and 3 doses, 10 microgram and 50 microgram. And the seroprotein data, we see that they are not inferior to anyone. 3-dose vaccine are equally good and effective. In the same way, in the clinical study phase 3, the safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization, a randomized, a comparator controlled multicentral phase 3 clinical study shows. So, to evaluate immunogenicity and safety of the rabies G protein vaccine administered as a simulated post-exposure immunization in the healthy volunteers. Randomized comparative control multicentric study, total subject 800, and we see in 037 regime, 3-day regime, and the 5-day regime, with the treated with the 533 subjects and 267 subjects. You see, to demonstrate the non-affinity of the test vaccine to the comparative vaccine. Here we see that the primary objective is subjects with the seroprotein at 16 days, at 14 days post first dose. And next secondary objective is subjects with seroprotection at a date of 42 post first exposure of the test vaccine. Here we see that the efficacy is quite good, safety is quite good from the Tha-Rabies, and the local adverse reactions are also less as compared to the others. So the conclusion of the study is this, that Tha-Rabies was not non-inferior to the reference vaccine, number one. Number two, less adverse effects as compared to the reference vaccine. And number three, novel 3 doses that the Tha-Rabies was found to be safe and immunogenic and was comparable to the 5 doses of WHO pre-qualified vaccine. With this, you see, the award goes to the Cadila vaccine as Pharma Innovation of the Year in the Economic Times, and the Golden Globe Tigers Award, Malaysia, for the innovative products of the year. So really, friends, thank you very much for hearing and listening this important 3-dose vaccine, which is not inferior to any other vaccine available in the market. So we should get the best of it, the use of this post-exposure immunization of the patient suffering from the suspected suffering from the rabies by the dog bites. Thank you very much. And if you have any query, I will welcome you all. Thank you.
Thank you, sir. Thank you very much. Now I हैंड ओवर टू, अगर किसी डॉक्टर साहब को कोई क्वेश्चन हो, कोई क्वेरी हो ट्रेविस के रिगार्डिंग, तो हमारे
Most
डॉक्टर
welcome.
डॉक्टर तो प्लीज अपना अपना कमेंट जो भी क्वेरी हो वो चैट बॉक्स में करें, मैं सर से आपका डिस्कस करवाऊंगा। Sir, I think a query has so thank you so much, Dr. Kumar, for the information. We truly appreciate your effort. Last but not the least, we like to inform you that Travis has won 2 prestigious award in innovation category, ET India Pharma Award and Global Globe Tiger Award. So all participants very thanks for the sir. Thank
Thank you. जनरल पार्टिसिपेंट ना सबको दिखते रहे तो ज्यादा अच्छा।
शेयर ऑब्जेक्ट ये टैब पे आ रहा है, अभी जब डाउनलोड किया ना ब्राउज़र पे सर्च करो, ये ऐड